1. Hand hygiene must be performed before and after every patient contact. True or false? Answer: true. Rationale: proper hand hygiene is the single most effective way to prevent the spread of infection and is required both before and after contact with any patient to ensure infection control. 2. Alcohol-based hand rubs are effective against Clostridium difficile spores. True or false? Answer: false. Rationale: alcohol-based hand rubs are not effective against C. difficile spores. Handwashing with soap and water is required to physically remove the spores. 3. N95 respirators are required for patients under airborne precautions. True or false? Answer: true. Rationale: N95 respirators filter airborne particles and are required when caring for patients with infections like tuberculosis, which are spread through airborne transmission. 4. Standard precautions should only be applied when a patient is known to be infected. True or false? Answer: false. Rationale: standard precautions are used for the care of all patients, regardless of infection status, to prevent transmission of infectious agents. 5. Surgical asepsis is used during insertion of a urinary catheter. True or false? Answer: true. Rationale: invasive procedures, such as urinary catheterization, require surgical asepsis to maintain sterility and prevent infection. 6. Gloves should be changed between tasks on the same patient. True or false? Answer: true. Rationale: gloves must be changed between different tasks or procedures on the same patient to avoid cross-contamination of body sites. 7. Droplet precautions require a negative pressure room. True or false? Answer: false. Rationale: droplet precautions do not require a negative pressure room. This is specific to airborne precautions. A private room is sufficient for droplet precautions. 8. Contact precautions are needed for patients with MRSA infections. True or false? Answer: true. Rationale: methicillin-resistant Staphylococcus aureus, MRSA, is spread by direct or indirect contact, requiring contact precautions to prevent transmission. 9. Gowns must be worn for every patient under standard precautions. True or false? Answer: false. Rationale: gowns are worn during standard precautions only when there is a risk of contact with blood, body fluids, secretions, or contaminated surfaces. 10. Isolation precautions can be discontinued as soon as the patient starts antibiotics. True or false? Answer: false. Rationale: isolation precautions should continue until the patient is no longer infectious, which may extend beyond the start of antibiotic therapy. 11. Surgical masks should be worn within 3 feet of a patient on droplet precautions. True or false? Answer: true. Rationale: droplets generally travel about 3 feet. Wearing a surgical mask within this distance protects against droplet transmission. 12. The proper order for doffing PPE is gloves, goggles, gown, mask. True or false? Answer: true. Rationale: this order minimizes the risk of self-contamination when removing personal protective equipment. 13. A mask is not required when suctioning a patient with influenza. True or false? Answer: false. Rationale: influenza spreads via droplets and suctioning may generate aerosols, so a mask is required to prevent exposure. 14. Hepatitis B virus can survive on environmental surfaces for up to 7 days. True or false? Answer: true. Rationale: HBV is highly stable in the environment and can remain infectious for up to 7 days on surfaces. 15. Sterilization kills all microorganisms, including spores. True or false? Answer: true. Rationale: sterilization is the complete destruction of all microorganisms, including bacterial spores. 16. A patient with chickenpox requires only droplet precautions. True or false? Answer: false. Rationale: chickenpox is spread via airborne transmission and requires airborne and contact precautions. 17. Healthcare workers with open wounds must cover them when providing patient care. True or false? Answer: true. Rationale: Open wounds can be a source of infection and must be covered to protect both the patient and the healthcare provider. 18. Blood spills should be cleaned with a 1:10 bleach solution. True or false? Answer: true. Rationale: a 1:10 bleach solution is effective for disinfecting surfaces contaminated with blood, inactivating bloodborne pathogens. 19. The use of artificial nails is prohibited in high-risk patient care areas. True or false? Answer: true. Rationale: artificial nails can harbor bacteria and are associated with healthcare-associated infections, particularly in critical care settings. 20. Hand hygiene is not required after removing gloves. True or false? Answer: false. Rationale: gloves may have microscopic tears, and hand hygiene is necessary after glove removal to prevent transmission of pathogens. 21. A sterile field can be maintained even if you turn your back on it. True or false? Answer: false. Rationale: a sterile field is considered contaminated if it is left unattended or if the provider turns their back on it. 22. PPE must be removed before exiting the room of a patient on contact precautions. True or false? Answer: true. Rationale: removing PPE before exiting the room prevents the spread of infectious agents to the environment and other patients. 23. Airborne infections require special air handling and ventilation systems. True or false? Answer: true. Rationale: airborne infections like TB require negative pressure rooms with specific ventilation to prevent spread of airborne particles. 24. Face shields can replace goggles for eye protection. True or false? Answer: true. Rationale: face shields provide equivalent eye protection to goggles and also protect other areas of the face. 25. It is safe to recap use needles as long as you use the one-hand technique. True or false? Answer: false. Rationale: recapping needles increases the risk of needle stick injuries and is discouraged, even with the one-hand technique. 26. Isolation gowns are single-use and should be discarded after use. True or false? Answer: true. Rationale: disposable gowns are intended for single use to prevent cross-contamination and must be discarded after patient care. 27. Surgical masks should be changed every 8 hours regardless of condition. True or false? Answer: false. Rationale: masks should be changed when they become moist or soiled, not simply based on time. 28. Patients on contact precautions can share rooms with other infected patients with the same pathogen. True or false? Answer: true. Rationale: cohorting is acceptable if both patients have the same confirmed infection and are managed with the same precautions. 29. The inner surface of a sterile glove is considered sterile. True or false? Answer: false. Rationale: the inner surface of the glove is not sterile, as it contacts the hands during donning. 30. Gloves are necessary when handling clean linens. True or false? Answer: false. Rationale: gloves are not required for handling clean linens unless they are visibly soiled or contaminated. 31. A mask with a face shield is sufficient for protection during a splash risk procedure. True or false? Answer: true. Rationale: a mask with a face shield protects the mucous membranes of the face from splashes and sprays. 32. Personal items such as phones should not be used in sterile environments. True or false? Answer: true. Rationale: personal items can harbor pathogens and compromise the sterile field, increasing infection risk. 33. A nurse can wear the same gloves when providing care to multiple patients if not visibly soiled. True or false? Answer: false. Rationale: gloves must be changed between patients to prevent cross-contamination, regardless of visible soiling. 34. Isolation signage should be posted outside the patient's door. True or false? Answer: true. Rationale: signage informs staff and visitors of the required precautions and helps prevent transmission. 35. Fingernails should be kept less than 1/4 inch long for infection control. True or false? Answer: true. Rationale: short nails reduce the risk of harboring and transmitting bacteria during patient care. 36. Linen from an isolation room can be transported without a special bag. True or false? Answer: false. Rationale: contaminated linens should be placed in a designated, labeled isolation bag to prevent exposure. 37. Antibiotic stewardship helps reduce antibiotic resistance and HAIs. True or false? Answer: true. Rationale: proper use of antibiotics helps limit resistance and lowers the risk of healthcare-associated infections. 38. Vaccination is not an important part of infection control in healthcare settings. True or false? Answer: false. Rationale: vaccinations protect healthcare workers and patients from preventable diseases and are essential to infection control. 39. Disinfectants are sufficient to sterilize surgical instruments. True or false? Answer: false. Rationale: disinfectants do not eliminate all microorganisms. Sterilization is required for surgical instruments. 40. Eye protection is necessary when there is potential for bodily fluid splashes. True or false? Answer: true. Rationale: mucous membranes of the eyes are a portal of entry for pathogens. Eye protection is necessary in splash risk situations. 41. Healthcare workers are required to wear PPE when administering oral medications. True or false? Answer: false. Rationale: PPE is generally not required for administering oral meds unless there is a risk of exposure to bodily fluids. 42. Disposing of sharps in regular trash is acceptable if no one is watching. True or false? Answer: false. Rationale: sharps must be disposed of in puncture-proof containers to prevent injury and infection transmission. 43. All PPE should be donned before entering an isolation room. True or false? Answer: true. Rationale: PPE must be put on before room entry to ensure full protection from exposure. 44. A sterile field should be established at waist level or higher. True or false? Answer: true. Rationale: anything below waist level is considered contaminated in sterile procedures. 45. HIV is easily transmitted through casual contact like handshaking. True or false? Answer: false. Rationale: HIV is not transmitted through casual contact. It requires direct contact with specific bodily fluids. 46. Alcohol hand rubs must be used for at least 20 seconds. True or false? Answer: true. Rationale: a 20-second application ensures sufficient contact time to eliminate most microbes on hands. 47. All reusable medical equipment must be cleaned before disinfection or sterilization. True or false? Answer: true. Rationale: cleaning removes organic material that may interfere with disinfection or sterilization processes. 48. It is acceptable to wear jewelry under gloves. True or false? Answer: false. Rationale: jewelry can tear gloves and harbor bacteria, compromising hand hygiene and glove integrity. 49. Healthcare workers should receive an annual influenza vaccine. True or false? Answer: true. Rationale: annual vaccination helps prevent the spread of influenza to vulnerable patients and staff. 50. You can reuse a disposable mask if stored properly. True or false? Answer: false. Rationale: disposable masks are single-use and must be discarded after each use to prevent contamination. 51. The incubation period is the time between exposure to a pathogen and the appearance of the first symptoms. True or false? Answer: true. Rationale: the incubation period is a key phase in infection development, often used for surveillance and isolation timing. 52. Transmission-based precautions are only required for patients with respiratory infections. True or false? Answer: false. Rationale: transmission-based precautions apply to airborne, droplet, and contact routes, not just respiratory infections. 53. Disinfectants used in healthcare settings must be approved by relevant health authorities. True or false? Answer: true. Rationale: only approved disinfectants ensure effectiveness against specific pathogens and meet regulatory standards. 54. Hand sanitizers are ineffective against Clostridioides difficile spores. True or false? Answer: true. Rationale: alcohol-based hand sanitizers do not kill C. difficile spores. Handwashing with soap and water is required. 55. Standard precautions should be followed only if the patient is visibly ill. True or false? Answer: false. Rationale: standard precautions apply to all patients regardless of symptoms to prevent undetected transmission. 56. Medical asepsis involves practices that reduce the number of microorganisms. True or false? Answer: true. Rationale: medical asepsis, or clean technique, minimizes microorganism spread but does not sterilize. 57. All healthcare personnel must wear N95 respirators when entering any isolation room. True or false? Answer: false. Rationale: N95 respirators are required only for airborne precautions, such as tuberculosis or measles. 58. Isolation signs outside patient rooms help guide staff and visitors on proper precautions. True or false? Answer: true. Rationale: these signs provide critical information about PPE use and entry protocols to reduce infection risk. 59. Single-use medical devices can be cleaned and reused if properly disinfected. True or false? Answer: false. Rationale: single-use devices are not designed for reuse and may pose safety and infection control risks. 60. Gloves can replace hand hygiene if worn properly. True or false? Answer: false. Rationale: hand hygiene is required before and after glove use. Gloves can still become contaminated. 61. Surgical asepsis is also known as sterile technique. True or false? Answer: true. Rationale: surgical asepsis eliminates all microorganisms and is used during invasive procedures to prevent infection. 62. Face shields provide full respiratory protection in airborne precautions. True or false? Answer: false. Rationale: face shields protect from splashes, but do not filter airborne particles, and N95 respirators are needed for airborne precautions. 63. Contact precautions require the use of gloves and gowns. True or false? Answer: true. Rationale: gloves and gowns protect against organisms transmitted through direct or indirect contact. 64. The chain of infection includes 6 elements, and breaking any one of them can stop transmission. True or false? Answer: true. Rationale: intervening at any point in the chain, agent, reservoir, portal of exit, mode, portal of entry, or host, can prevent infection. 65. All bodily fluids are considered potentially infectious under standard precautions. True or false? Answer: true. Rationale: standard precautions treat all blood and bodily fluids, except sweat, as potentially infectious. 66. The use of PPE eliminates the need for hand hygiene. True or false? Answer: false. Rationale: hand hygiene is essential even when PPE is used, as contamination can still occur during removal. 67. The use of chlorhexidine is more effective than soap alone for surgical scrubs. True or false? Answer: true. Rationale: chlorhexidine has broad-spectrum antimicrobial activity and residual effects, making it ideal for surgical scrubs. 68. Droplet precautions require a private room and use of a surgical mask within 3 feet of the patient. True or false? Answer: true. Rationale: droplet transmission occurs via large respiratory particles, requiring a mask and distancing. 69. The removal of PPE should always begin with the mask. True or false? Answer: false. Rationale: gloves are removed first to reduce the risk of contaminating other PPE and the hands. 70. High-touch surfaces like bed rails and floor pumps need frequent disinfection. True or false? Answer: true. Rationale: high-touch surfaces harbor pathogens and require frequent cleaning to reduce transmission risk. 71. Infection control is less important in outpatient care settings. True or false? Answer: false. Rationale: infection prevention is critical in all healthcare settings to protect patients and staff. 72. Airborne infections can be transmitted over long distances via ventilation systems. True or false? Answer: true. Rationale: pathogens like TB can spread through tiny particles that remain suspended in air and travel through HVAC systems. 73. Cleaning is a form of sterilization. True or false? Answer: false. Rationale: cleaning removes visible debris but does not kill microorganisms. Sterilization is needed to eliminate all microbes. 74. PPE should be donned before entering the patient's room and doffed before exiting. True or false? Answer: true. Rationale: this minimizes contamination of clean areas and protects healthcare personnel. 75. Patients with multi-drug-resistant organisms, MDROs, should be placed under contact precautions. True or false? Answer: true. Rationale: MDROs spread via contact and require enhanced barrier precautions to prevent outbreaks. 76. Masks should be worn by patients on airborne precautions when transported. True or false? Answer: true. Rationale: this limits the spread of airborne particles during transport through hallways or shared spaces. 77. Handwashing for 10 seconds is sufficient to remove all pathogens. True or false? Answer: false. Rationale: handwashing should last at least 20 seconds to effectively remove dirt and pathogens. 78. Autoclaving is a method used to sterilize surgical instruments. True or false? Answer: true. Rationale: autoclaving uses high-pressure steam to destroy all microorganisms on instruments. 79. A sterile field remains sterile even if unattended. True or false? Answer: false. Rationale: a sterile field should not be left unattended as it may become contaminated without visual monitoring. 80. It is acceptable to recap use needles after injections. True or false? Answer: false. Rationale: recapping needles increases the risk of needle stick injuries. They should be disposed of immediately in sharps containers. 81. Infection can occur even in the absence of visible signs and symptoms. True or false? Answer: true. Rationale: asymptomatic carriers can harbor and transmit infections without showing clinical signs. 82. The incubation period is the time from exposure to the appearance of the first symptoms. True or false? Answer: true. Rationale: the incubation period refers to the interval between pathogen exposure and onset of symptoms. 83. Sterile gloves are required for routine vital sign assessments. True or false? Answer: false. Rationale: clean gloves or hand hygiene are sufficient for non-invasive procedures like vital sign assessments. 84. The use of alcohol-based hand rubs is less effective than soap and water. True or false? Answer: false. Rationale: alcohol-based hand rubs are effective in most situations unless hands are visibly soiled. 85. Fomites are living organisms that transmit infection. True or false? Answer: false. Rationale: fomites are inanimate objects that can carry infectious agents, not living organisms. 86. Healthcare workers can be sources of nosocomial infections. True or false? Answer: true. Rationale: improper hand hygiene and lack of precautions by healthcare workers can lead to healthcare-associated infections. 87. Protective isolation is used for immunocompromised patients. True or false? Answer: true. Rationale: protective isolation prevents infection in patients with weakened immune systems by limiting exposure to pathogens. 88. The term bacteremia refers to bacteria present in the lungs. True or false? Answer: false. Rationale: bacteremia refers to bacteria in the bloodstream, not in the lungs. 89. Surgical masks filter out small airborne particles. True or false? Answer: false. Rationale: surgical masks block large droplets, but do not effectively filter small airborne particles like N95 respirators. 90. Soiled linen should be handled as little as possible and with minimal agitation. True or false? Answer: true. Rationale: Minimal handling reduces the risk of airborne contamination from particles and pathogens. 91. Only patients with diagnosed infections require standard precautions. True or false? Answer: false. Rationale: standard precautions are applied universally, regardless of a patient's infection status. 92. The skin is the body's first line of defense against infection. True or false? Answer: true. Rationale: intact skin acts as a physical barrier preventing the entry of pathogens. 93. Gloves should be worn when touching intact skin. True or false? Answer: false. Rationale: gloves are not necessary for contact with intact skin unless required by isolation protocols. 94. Hand hygiene must be performed before and after using gloves. True or false? Answer: true. Rationale: gloves are not a substitute for hand hygiene, which must be done before donning and after removing gloves. 95. A sterile object is considered contaminated if it touches a non-sterile surface. True or false? Answer: true. Rationale: any contact with a non-sterile surface breaks sterility, rendering the item contaminated. 96. Cleaning instruments before disinfection or sterilization is unnecessary. True or false? Answer: false. Rationale: cleaning removes debris and is essential before disinfection or sterilization to ensure effectiveness. 97. Use of antimicrobial soap is recommended for routine hand washing. True or false? Answer: false. Rationale: plain soap is adequate for routine hand washing. Antimicrobial soap is used in specific clinical settings. 98. Tuberculosis requires the use of droplet precautions. True or false? Answer: false. Rationale: TB requires airborne precautions, not droplet, due to its transmission through fine airborne particles. 99. Isolation precautions should be based on the mode of transmission. True or false? Answer: true. Rationale: transmission-based precautions, contact, droplet, airborne, depend on how the infection spreads. 100. Patients with suspected C. difficile infection should be placed under airborne precautions. True or false? Answer: false. Rationale: C. difficile requires contact precautions and hand washing with soap and water, not airborne isolation. 101. The chain of infection includes a reservoir, portal of exit, mode of transmission, and portal of entry. True or false? Answer: true. Rationale: these are critical links in the chain of infection and must be broken to prevent transmission. 102. A vaccine provides active immunity by stimulating antibody production. True or false? Answer: true. Rationale: vaccines introduce antigens that trigger the body's immune response and create memory cells for future protection. 103. N95 respirators are necessary when caring for a patient with measles. True or false? Answer: true. Rationale: measles is an airborne infection requiring airborne precautions, including an N95 respirator. 104. Infection control is only important in hospital settings. True or false? Answer: false. Rationale: infection control is essential in all healthcare settings, including outpatient, home care, and long-term care. 105. Respiratory hygiene includes covering the mouth and nose when coughing. True or false? Answer: true. Rationale: this practice helps prevent the spread of respiratory pathogens through droplets. 106. Candida albicans is an example of a viral infection. True or false? Answer: false. Rationale: Candida albicans is a fungus, not a virus, and can cause opportunistic infections like thrush. 107. A fomite is a type of vector that lives and transmits pathogens. True or false? Answer: false. Rationale: fomites are inanimate objects. Vectors are living organisms like insects. 108. Contact precautions require the use of a gown and gloves. True or false? Answer: true. Rationale: gown and gloves prevent the transmission of pathogens through direct or indirect contact. 109. Viral infections are effectively treated with antibiotics. True or false? Answer: false. Rationale: antibiotics treat bacterial infections. Antiviral drugs are needed for viruses. 110. Surgical asepsis refers to techniques that keep areas free of all microorganisms. True or false? Answer: true. Rationale: surgical asepsis or sterile technique eliminates all microbes to prevent infection during invasive procedures. 111. The CDC recommends standard precautions for all patient interactions, regardless of diagnosis. True or false? Answer: true. Rationale: standard precautions apply to all patients to prevent cross-contamination. 112. It is acceptable to reuse single-use gloves if they are not torn. True or false? Answer: false. Rationale: single-use gloves must be discarded after one use to prevent cross-contamination. 113. Hepatitis B can be transmitted via contaminated needles. True or false? Answer: true. Rationale: HBV is a blood-borne virus and can be spread through needle stick injuries. 114. It is unnecessary to clean non-critical medical equipment between patients. True or false? Answer: false. Rationale: all equipment must be cleaned between uses to prevent cross-contamination. 115. Alcohol-based rubs are ineffective against Clostridium difficile. True or false? Answer: true. Rationale: C. difficile spores are resistant to alcohol and require handwashing with soap and water. 116. Blood and all body fluids, except sweat, are considered potentially infectious. True or false? Answer: true. Rationale: according to standard precautions, all body fluids, except sweat, are treated as potentially infectious. 117. Removing gloves eliminates the need for hand hygiene. True or false? Answer: false. Rationale: hands may still be contaminated during glove removal. Hygiene is essential. 118. Patients on airborne precautions must be placed in a negative pressure room. True or false? Answer: true. Rationale: negative pressure rooms prevent airborne pathogens from escaping into other areas. 119. The portal of exit is the way a pathogen leaves the host. True or false? Answer: true. Rationale: this can occur through body fluids like saliva, blood, or respiratory droplets. 120. Infection control only involves nursing staff. True or false? Answer: false. Rationale: all healthcare personnel must adhere to infection control practices to ensure patient safety. 121. Airborne diseases can be transmitted by particles smaller than 5 microns. True or false? Answer: true. Rationale: airborne pathogens like tuberculosis are transmitted via droplet nuclei smaller than 5 microns that remain suspended in the air. 122. Hand hygiene is considered the single most effective method for preventing the spread of infection. True or false? Answer: true. Rationale: proper hand hygiene breaks the chain of infection and is the cornerstone of all infection control practices. 123. Personal protective equipment, PPE, includes a lab coat, sandals, and a stethoscope. True or false? Answer: false. Rationale: PPE includes gloves, gowns, masks, and eye protection. Lab coats and sandals do not meet PPE standards. 124. A patient with active tuberculosis should be placed on droplet precautions. True or false? Answer: false. Rationale: tuberculosis requires airborne precautions, not droplet, due to its transmission through small particles. 125. Antiseptics are used to disinfect surgical instruments. True or false? Answer: false. Rationale: antiseptics are for use on skin. Disinfectants are used for inanimate objects like surgical instruments. 126. MRSA, methicillin-resistant Staphylococcus aureus, is spread by contact. True or false? Answer: true. Rationale: MRSA is transmitted through direct or indirect contact, requiring contact precautions. 127. Isolation precautions are only required for patients with confirmed infections. True or false? Answer: false. Rationale: Isolation may be implemented based on clinical suspicion while awaiting confirmation to prevent spread. 128. Immunocompromised patients are more susceptible to opportunistic infections. True or false? Answer: true. Rationale: their weakened immune systems cannot effectively fight off infections that are normally harmless. 129. Droplet precautions require a surgical mask within 3 feet of the patient. True or false? Answer: true. Rationale: droplets travel short distances, typically up to 3 feet, so a mask is needed within that range. 130. Sterile gloves are always required for standard precautions. True or false? Answer: false. Rationale: clean, non-sterile gloves are sufficient for most standard precautions unless performing sterile procedures. 131. Hepatitis C can be spread through casual contact such as hugging. True or false? Answer: false. Rationale: hepatitis C is bloodborne and not spread through casual contact. 132. Reverse isolation is used to protect the patient from others. True or false? Answer: true. Rationale: reverse isolation protects immunocompromised patients from being infected by healthcare staff or visitors. 133. Cough etiquette is part of standard precautions. True or false? Answer: true. Rationale: covering coughs and sneezes prevents droplet spread and is part of standard infection control. 134. All waste from an isolation room must be treated as regular trash. True or false? Answer: false. Rationale: waste from isolation rooms must be handled as biohazardous waste to prevent cross-contamination. 135. Infection can occur even if only one link in the chain of infection is present. True or false? Answer: false. Rationale: all links in the chain must be present for an infection to occur. Breaking any link interrupts transmission. 136. Healthcare-associated infections, HAIs, are often preventable. True or false? Answer: true. Rationale: many HAIs can be avoided through strict adherence to infection control practices and protocols. 137. Gloves should be worn when touching blood, body fluids, or contaminated surfaces. True or false? Answer: true. Rationale: gloves provide a barrier and protect both the healthcare worker and the patient. 138. Infection control protocols vary significantly between hospitals and clinics. True or false? Answer: false. Rationale: while implementation might vary, standard infection control guidelines like CDC and WHO are consistent across settings. 139. Only nurses are responsible for ensuring infection control compliance. True or false? Answer: false. Rationale: all healthcare staff share responsibility for maintaining infection control standards. 140. The presence of microorganisms always leads to infection. True or false? Answer: false. Rationale: many microorganisms are non-pathogenic and part of normal flora. Infection occurs when pathogens overcome the host's defenses. 141. Alcohol-based hand sanitizers are effective against most bacteria and viruses. True or false? Answer: true. Rationale: alcohol-based hand rubs effectively kill many common pathogens, including most bacteria and enveloped viruses. 142. Standard precautions apply only to patients with known infections. True or false? Answer: false. Rationale: standard precautions are applied to the care of all patients, regardless of suspected or confirmed infection status. 143. Surgical asepsis involves maintaining a sterile field and using sterile techniques. True or false? Answer: true. Rationale: surgical asepsis ensures that an area is free from all microorganisms, including spores. 144. The chain of infection includes reservoir, mode of transmission, and susceptible host. True or false? Answer: true. Rationale: these are 3 of the 6 links in the chain of infection, which also includes the infectious agent, portal of entry, and portal of exit. 145. Contact isolation requires a negative pressure room. True or false? Answer: false. Rationale: Negative pressure rooms are required for airborne precautions, not for contact isolation. 146. All PPE should be removed before exiting a patient's room. True or false? Answer: true. Rationale: PPE should be removed before leaving the patient environment to prevent contamination of outside areas. 147. A sterile object remains sterile even if it touches a clean, non-sterile object. True or false? Answer: false. Rationale: contact with a non-sterile object contaminates a sterile object, violating aseptic technique. 148. Infection control practices are only necessary in hospitals. True or false? Answer: false. Rationale: infection control is essential in all healthcare settings, including clinics, long-term care, and home care. 149. The skin is considered the first line of defense against infection. True or false? Answer: true. Rationale: intact skin serves as a physical barrier preventing the entry of pathogens. 150. A patient with Clostridium difficile, C. diff, infection should be on airborne precautions. True or false? Answer: false. Rationale: C. diff requires contact precautions and handwashing with soap and water, as alcohol does not kill its spores. 151. Eye protection is necessary when there is a risk of splashes or sprays of body fluids. True or false? Answer: true. Rationale: goggles or face shields protect mucous membranes of the eyes from infectious fluids. 152. Surgical masks are sufficient for protection against measles. True or false? Answer: false. Rationale: measles requires airborne precautions, including the use of an N95 respirator mask. 153. Patients with open wounds should always be in isolation. True or false? Answer: false. Rationale: not all open wounds require isolation, only those infected or at high risk of infection transmission. 154. The incubation period is the time between exposure to a pathogen and the appearance of symptoms. True or false? Answer: true. Rationale: the incubation period is the asymptomatic phase after infection when the organism multiplies. 155. The use of gloves eliminates the need for hand hygiene. True or false? Answer: false. Rationale: hands should be cleaned before and after glove use to prevent contamination. 156. Sterile technique is required when inserting a urinary catheter. True or false? Answer: true. Rationale: invasive procedures like catheter insertion require sterile technique to prevent infection. 157. Bacteria that are resistant to multiple antibiotics are known as superbugs. True or false? Answer: true. Rationale: superbugs, such as MRSA or VRE, are resistant to several classes of antibiotics, making them difficult to treat. 158. Proper disposal of sharps includes recapping used needles. True or false? Answer: false. Rationale: recapping needles increases the risk of needle stick injuries. Used sharps should be immediately disposed in puncture-resistant containers. 159. Fomites are inanimate objects that can carry infectious agents. True or false? Answer: true. Rationale: fomites like stethoscopes or doorknobs can harbor pathogens and spread infection. 160. Antibiotics are effective against both bacterial and viral infections. True or false? Answer: false. Rationale: antibiotics only treat bacterial infections. They are ineffective against viruses. 161. Hand hygiene is the most effective method for preventing the spread of infections. True or false? Answer: true. Rationale: hand hygiene, especially hand washing with soap and water or using alcohol-based hand rub, is the most effective way to prevent infection transmission. 162. A face shield provides adequate protection for the mucous membranes of the eyes, nose, and mouth during patient care. True or false? Answer: true. Rationale: a face shield covers the entire face, providing protection from splashes and sprays of bodily fluids. 163. It is acceptable to reuse a disposable mask if it has not been soiled. True or false? Answer: false. Rationale: Disposable masks are designed for single use only and should be discarded after each patient encounter. 164. Droplet precautions are required for diseases such as influenza and pertussis. True or false? Answer: true. Rationale: droplet precautions are required for diseases transmitted through large respiratory droplets such as influenza and pertussis. 165. Airborne precautions require patients to be placed in a negative pressure room. True or false? Answer: true. Rationale: airborne precautions require negative pressure rooms to prevent the spread of infectious particles to other areas. 166. A clean object can remain sterile if it is left uncovered in a clean environment. True or false? Answer: false. Rationale: sterile objects must remain covered and protected to prevent contamination from airborne particles or touch. 167. It is safe to wear the same pair of gloves throughout multiple patient interactions as long as there is no visible contamination. True or false? Answer: false. Rationale: gloves should be changed between patient interactions to prevent cross-contamination, even if they appear clean. 168. Hand hygiene should be performed after removing gloves. True or false? Answer: true. Rationale: hand hygiene should always be performed after glove removal to eliminate any potential contamination from the gloves. 169. Infected patients must always be placed in isolation, even if they do not show symptoms. True or false? Answer: false. Rationale: not all infections require isolation. It depends on the disease and mode of transmission. For asymptomatic patients, isolation may not be necessary. 170. Antiseptics can be used on living tissues to prevent infection. True or false? Answer: true. Rationale: antiseptics are chemical agents applied to living tissues to reduce the risk of infection. 171. Patients with immunocompromised conditions should follow the same infection control practices as the general population. True or false? Answer: false. Rationale: immunocompromised patients require additional precautions to protect them from infections due to their weakened immune system. 172. It is safe to place a sterile object in a sterile field even if it has been touched by a non-sterile object. True or false? Answer: false. Rationale: contact with non-sterile objects contaminates the sterile object, violating sterile technique. 173. The effectiveness of alcohol-based hand sanitizers is reduced when hands are visibly dirty. True or false? Answer: true. Rationale: alcohol-based hand sanitizers are less effective when hands are visibly dirty or contaminated with organic material. 174. The use of personal protective equipment, PPE, is necessary only during high-risk procedures. True or false? Answer: false. Rationale: PPE should be used according to the patient's condition, the task being performed, and the type of exposure risk, not just during high-risk procedures. 175. A gown is required for all patient interactions to prevent the spread of infection. True or false? Answer: false. Rationale: gowns are required only when there is a risk of contamination of clothing with body fluids or secretions. 176. Infected wounds should be covered with a sterile dressing to prevent the spread of infection. True or false? Answer: true. Rationale: a sterile dressing helps contain the wound's secretions and prevents contamination from the environment. 177. Gloves should always be worn when handling contaminated patient items, such as linens. True or false? Answer: true. Rationale: gloves should be worn when handling any potentially contaminated items to prevent transmission of infectious agents. 178. If a healthcare worker has a minor cut on their hand, they should continue to provide patient care without any additional precautions. True or false? Answer: false. Rationale: healthcare workers with open cuts or wounds should use proper protective equipment, such as gloves, to prevent exposure to infectious materials. 179. Transmission-based precautions are implemented only when a patient has been diagnosed with a specific infectious disease. True or false? Answer: true. Rationale: transmission-based precautions are applied based on the known or suspected mode of transmission of a patient's infection. 180. Patients with a positive methicillin-resistant Staphylococcus aureus, MRSA, culture should be placed in contact isolation. True or false? Answer: true. Rationale: MRSA is a highly contagious bacterium resistant to many antibiotics, and contact isolation is required to prevent its spread. 181. Surgical masks are effective in protecting healthcare workers from airborne pathogens. True or false? Answer: false. Rationale: surgical masks are designed to protect against droplet transmission but are not effective for airborne pathogens, which require N95 respirators. 182. The use of personal protective equipment, PPE, includes gloves, gowns, masks, and eye protection. True or false? Answer: true. Rationale: PPE is composed of gloves, gowns, masks, and eye protection, and is used to minimize exposure to infectious agents. 183. If a patient is known to be infected with a multi-drug resistant organism, strict isolation is required regardless of symptoms. True or false? Answer: true. Rationale: multi-drug resistant organisms require strict isolation to prevent the spread of resistant infections. 184. Antibiotics are effective in treating viral infections such as the common cold and influenza. True or false? Answer: false. Rationale: antibiotics are only effective against bacterial infections and do not treat viral infections. 185. Hand hygiene should be performed for at least 20 seconds when washing hands with soap and water. True or false? Answer: true. Rationale: hand hygiene with soap and water should last for at least 20 seconds to effectively remove germs. 186. Respirators, such as N95 masks, should be used when treating patients with tuberculosis. True or false? Answer: true. Rationale: tuberculosis is transmitted via airborne droplets, and N95 respirators provide the necessary protection. 187. Airborne precautions are necessary for diseases such as measles and chickenpox. True or false? Answer: true. Rationale: measles and chickenpox are transmitted through airborne particles, so airborne precautions are needed. 188. It is acceptable to wear a mask for the entire duration of a shift without changing it. True or false? Answer: false. Rationale: masks should be changed when they become moist, soiled, or after patient care to maintain their effectiveness. 189. If a healthcare worker has been exposed to blood or bodily fluids, they should immediately wash the exposed area and report the incident. True or false? Answer: true. Rationale: immediate washing of the exposed area and reporting the incident helps prevent potential infection and ensures proper follow-up care. 190. It is safe to reuse disposable gloves if the healthcare worker is handling the same patient. True or false? Answer: false. Rationale: disposable gloves should be discarded after each patient contact to prevent cross-contamination. 191. When providing care for a patient with a respiratory infection, it is important to ensure the patient is in a private room. True or false? Answer: true. Rationale: a private room helps prevent the spread of respiratory infections to other patients. 192. Wearing gloves can eliminate the need for hand hygiene. True or false? Answer: false. Rationale: hand hygiene should always be performed before and after glove use to ensure that hands remain free from contamination. 193. Standard precautions should be followed with every patient, regardless of their infection status. True or false? Answer: true. Rationale: standard precautions are used for all patients to reduce the risk of infection transmission. 194. It is acceptable to wear the same gown for multiple patient interactions if it has not been soiled. True or false? Answer: false. Rationale: gowns should be changed after each patient contact to prevent cross-contamination. 195. The primary goal of infection control practices is to eliminate all pathogens. True or false? Answer: false. Rationale: the goal is to reduce the transmission of pathogens, not necessarily to eliminate all pathogens, as some may persist in the environment. 196. To prevent contamination, sterile equipment should only be opened right before use. True or false? Answer: true. Rationale: sterile equipment should only be exposed to air and handling immediately before use to prevent contamination. 197. A patient with a known viral infection, such as HIV, requires contact precautions only. True or false? Answer: false. Rationale: the level of isolation depends on the specific infection and the risk of transmission, so the correct type of isolation should be used. 198. Hand hygiene can be performed using alcohol-based hand rubs if there is no visible dirt or organic material on the hands. True or false? Answer: true. Rationale: alcohol-based hand rubs are effective when hands are not visibly soiled, and they can quickly eliminate most pathogens. 199. Infection control protocols for high-risk patients, such as those undergoing surgery, should be more stringent than for low-risk patients. True or false? Answer: true. Rationale: high-risk patients are more susceptible to infections, so enhanced infection control measures are necessary to protect them. 200. Only healthcare workers who are directly involved in patient care need to follow infection control procedures. True or false? Answer: false. Rationale: infection control procedures should be followed by all healthcare workers, including those in administrative and support roles, to prevent the spread of infections. 201. The use of alcohol-based hand sanitizers is effective for removing all pathogens, including norovirus. True or false? Answer: false. Rationale: alcohol-based hand sanitizers are not effective against certain pathogens like norovirus, which requires proper hand washing with soap and water. 202. Disinfection is the process of killing or inactivating nearly all microorganisms, including bacterial spores. True or false? Answer: false. Rationale: disinfection kills most microorganisms but does not eliminate bacterial spores. Sterilization is required to kill spores. 203. Patients with infections that are transmitted via contact precautions should be placed in a private room. True or false? Answer: true. Rationale: private rooms are recommended for patients with infections transmitted via contact precautions to reduce the risk of transmission. 204. The transmission of infections through the air is prevented by wearing surgical masks. True or false? Answer: false. Rationale: surgical masks are not sufficient to prevent airborne infections. N95 respirators are needed for airborne precautions. 205. It is important to follow the manufacturer's instructions when cleaning and disinfecting patient care equipment. True or false? Answer: true. Rationale: following the manufacturer's instructions ensures that equipment is disinfected properly and prevents cross-contamination. 206. Infected healthcare workers can transmit infections to patients and should report symptoms immediately. True or false? Answer: true. Rationale: healthcare workers with infections can transmit pathogens to patients, so it is essential to report symptoms to prevent further spread. 207. Hand hygiene should be performed before touching a clean surface and after touching a contaminated surface. True or false? Answer: true. Rationale: hand hygiene helps prevent cross-contamination by ensuring hands are clean before touching clean surfaces and after touching contaminated ones. 208. Gowns should be worn during all patient care, regardless of infection status. True or false? Answer: false. Rationale: gowns are only required for patients who have a known or suspected infection that could be transmitted through direct contact or bodily fluids. 209. The use of disposable equipment reduces the risk of infection transmission in healthcare settings. True or false? Answer: true. Rationale: disposable equipment helps minimize the risk of cross-contamination between patients and environments. 210. Vaccination of healthcare workers is an essential component of infection control practices. True or false? Answer: true. Rationale: vaccination helps prevent healthcare workers from contracting and spreading infectious diseases in healthcare settings. 211. The flu vaccine is only recommended for healthcare workers who work directly with patients. True or false? Answer: false. Rationale: the flu vaccine is recommended for all healthcare workers, as they may still come into contact with infected individuals, even indirectly. 212. Healthcare workers should change gloves between tasks to prevent contamination. True or false? Answer: true. Rationale: changing gloves between tasks helps prevent the transfer of pathogens from one patient or area to another. 213. If a surface appears clean, it does not need to be disinfected. True or false? Answer: false. Rationale: surfaces that appear clean may still be contaminated with pathogens and need to be properly disinfected. 214. Properly maintaining ventilation systems can help reduce the spread of airborne infections in healthcare facilities. True or false? Answer: true. Rationale: proper ventilation reduces the concentration of airborne pathogens and helps prevent the spread of infections. 215. Patients in the same room with an infected individual should wear masks to reduce the risk of infection. True or false? Answer: true. Rationale: wearing masks reduces the risk of droplet transmission between patients and healthcare workers in shared spaces. 216. Is acceptable to reuse face shields as long as they are cleaned between uses. True or false? Answer: true. Rationale: face shields can be reused as long as they are cleaned and disinfected properly after each use to prevent cross-contamination. 217. If a healthcare worker is in direct contact with a patient's blood or bodily fluids, they must wear gloves and a gown. True or false? Answer: true. Rationale: gloves and gowns protect healthcare workers from exposure to infectious blood or bodily fluids. 218. Infected surfaces should be wiped with a clean, dry cloth to remove pathogens. True or false? Answer: false. Rationale: surfaces should be cleaned with a disinfectant, not just a dry cloth, to effectively kill pathogens and prevent infection spread. 219. Infection control procedures should be followed more strictly when caring for patients with compromised immune systems. True or false? Answer: true. Rationale: patients with compromised immune systems are more vulnerable to infections, so infection control procedures must be followed rigorously. 220. Healthcare workers should dispose of contaminated PPE immediately after use to prevent transmission of infectious agents. True or false? Answer: true. Rationale: contaminated PPE should be disposed of immediately to prevent the spread of infectious agents to other patients or environments. 221. Alcohol-based hand sanitizers are effective in killing Clostridium difficile spores. True or false? Answer: false. Rationale: alcohol-based hand sanitizers are not effective against Clostridium difficile spores, which require washing with soap and water. 222. A healthcare worker who has been exposed to a bloodborne pathogen should undergo post-exposure prophylaxis (PEP) treatment. True or false? Answer: true. Rationale: post-exposure prophylaxis (PEP) is recommended for healthcare workers who have been exposed to bloodborne pathogens to prevent infection. 223. Protective isolation is used for patients with a weakened immune system to prevent exposure to pathogens. True or false? Answer: true. Rationale: protective isolation, or reverse isolation, is used to protect immunocompromised patients from infections that they could acquire from their surroundings. 224. Universal precautions are only necessary when caring for patients with known infectious diseases. True or false? Answer: false. Rationale: universal precautions should be used with all patients, regardless of their known infection status, to prevent the spread of infection. 225. Isolation precautions should be discontinued as soon as a patient's symptoms improve. True or false? Answer: false. Rationale: isolation precautions should not be discontinued until the patient is no longer contagious, even if symptoms improve. 226. N95 respirators should be worn when caring for patients with tuberculosis. True or false? Answer: true. Rationale: N95 respirators are required for airborne precautions when caring for patients with tuberculosis, as it is transmitted through the air. 227. A patient with a methicillin-resistant Staphylococcus aureus (MRSA) infection should be placed in a private room. True or false? Answer: true. Rationale: MRSA is spread through direct contact, and placing the patient in a private room reduces the risk of transmission. 228. The risk of infection transmission is reduced when healthcare workers clean their hands after patient contact. True or false? Answer: true. Rationale: proper hand hygiene after patient contact reduces the risk of transmission of pathogens to other patients and healthcare workers. 229. When a patient is placed under airborne precautions, they should be placed in a room with negative pressure. True or false? Answer: true. Rationale: negative pressure rooms help prevent the spread of airborne pathogens, as air is drawn into the room and filtered before being released. 230. Gloves should be worn when handling patient care items such as linens, even if the linens appear clean. True or false? Answer: true. Rationale: gloves should be worn when handling any patient care items, including linens, to prevent cross-contamination, even if they appear clean. 231. The use of personal protective equipment, PPE, is essential for preventing healthcare-associated infections, HAIs. True or false? Answer: true. Rationale: PPE, including gloves, gowns, masks, and face shields, is essential in preventing healthcare-associated infections, HAIs, by protecting both healthcare workers and patients. 232. Surgical masks are adequate for preventing the transmission of tuberculosis in healthcare settings. True or false? Answer: false. Rationale: tuberculosis requires airborne precautions, including the use of N95 respirators, not surgical masks, to protect against transmission. 233. Isolation precautions for a patient with a viral infection should follow the same guidelines as for a bacterial infection. True or false? Answer: false. Rationale: isolation precautions may vary depending on the type of infection, viral or bacterial, as different pathogens require different approaches to prevent transmission. 234. It is acceptable to wear the same pair of gloves for multiple tasks on the same patient, as long as they are not visibly soiled. True or false? Answer: false. Rationale: gloves should be changed between tasks to prevent cross-contamination, even if they are not visibly soiled. 235. Clean hands should be dried with paper towels after washing. True or false? Answer: true. Rationale: paper towels are recommended for drying hands after washing to prevent recontamination with bacteria from cloth towels. 236. Contaminated or soiled linen should be placed directly on the floor before being placed in a laundry bag. True or false? Answer: false. Rationale: contaminated linen should not touch the floor, as this can lead to further contamination. It should be placed in a laundry bag directly. 237. It is essential for healthcare workers to follow standard precautions, such as wearing gloves, even when caring for patients with no known infections. True or false? Answer: true. Rationale: standard precautions, including wearing gloves, should be followed for all patients to reduce the risk of transmission of unknown infections. 238. The use of antibiotics in infection control practices can contribute to the development of antibiotic-resistant organisms. True or false? Answer: true. Rationale: the overuse and misuse of antibiotics can lead to the development of antibiotic-resistant organisms, making infections harder to treat. 239. A mask should be worn during procedures that involve the potential for splashing or spraying of blood or body fluids. True or false? Answer: true. Rationale: masks are necessary to protect healthcare workers from exposure to blood or body fluids during procedures that may cause splashing or spraying. 240. Infection control measures for patients with multi-drug-resistant organisms, MDROs, are generally less stringent than for patients with other types of infections. True or false? Answer: false. Rationale: infection control measures for MDROs are more stringent to prevent the spread of resistant pathogens, often requiring isolation and contact precautions. 241. A face shield is required when performing procedures that have the potential for blood or body fluid splashes. True or false? Answer: true. Rationale: A face shield is required to protect the mucous membranes of the face during procedures that could cause blood or body fluid splashes, ensuring proper infection control. 242. Hand washing with soap and water should always be performed after touching contaminated surfaces. True or false? Answer: true. Rationale: washing hands with soap and water is essential after contact with contaminated surfaces to remove any pathogens and prevent the spread of infection. 243. A surgical mask is effective in preventing the spread of airborne diseases like tuberculosis. True or false? Answer: false. Rationale: a surgical mask is not effective for preventing the spread of airborne diseases like tuberculosis. An N95 respirator is required for such diseases. 244. Droplet precautions are needed for patients with diseases like influenza. True or false? Answer: true. Rationale: influenza is transmitted through respiratory droplets, so droplet precautions, such as wearing a mask, are required for patients with this infection. 245. A healthcare worker should wear gloves when handling medication for a patient who has a known infectious disease. True or false? Answer: true. Rationale: gloves should be worn to prevent the transmission of infection when handling medications for patients with known infectious diseases. 246. It is safe to reuse personal protective equipment, PPE, if it is visibly clean. True or false? Answer: false. Rationale: PPE should not be reused as it may become contaminated during use, increasing the risk of infection transmission. New PPE should be used for each patient interaction. 247. A healthcare worker can wash their hands with alcohol-based hand sanitizers if the hands are visibly dirty. True or false? Answer: false. Rationale: alcohol-based hand sanitizers are not effective if hands are visibly dirty. Soap and water should be used in such cases to properly clean the hands. 248. Antibiotics should be prescribed to all patients with a fever to prevent infection spread. True or false? Answer: false. Rationale: antibiotics should not be prescribed for all patients with fever unless a bacterial infection is confirmed, as antibiotics are not effective for viral infections and can contribute to resistance. 249. Contact precautions are necessary for patients with wound infections that are draining. True or false? Answer: true. Rationale: wound infections with drainage can spread pathogens through contact, so contact precautions, including wearing gloves and gowns, are necessary to prevent transmission. 250. A patient with suspected viral meningitis should be placed on airborne precautions. True or false? Answer: false. Rationale: viral meningitis is not spread through airborne transmission. Standard precautions or droplet precautions, depending on the suspected virus, should be followed.